So good day, everyone, and welcome, and thank you for joining another GPI webinar. I'm the Community of Practice Lead. I'm Genevieve Kaptrani, and we have a very exciting webinar lined up today, highlighting parenting in Africa. And our expertise, we have a panel that we've put together, and our expertise range from government officials to practitioners, researchers, as well as implementers. And this panel will delve into emerging trends, cultural considerations, and innovative solutions shaping the future of parenting in Africa. So like I said, we have a wonderful panel lined up. And before I hand over to Dr. Isang Awa, who will be introducing and leading this panel today, there are just a few housekeeping points I'd like to mention. So just please note that this is a recorded event and will be made publicly available. To avoid any disruptions, only the speakers' cameras and microphones will be active during the session. And if time allows, we'll have a Q&A session at the end, which I know Isang will keep us to time so that we do have a Q&A session at the end. But there is also a Q&A box where you can just put your questions in, and maybe panelists are able to answer the questions during the session. And so now I'll hand over to Isang to kick us off for this session today. Thank you.
Thank you so much, Jen, and good day, everyone. And welcome again to our webinar on parenting in Africa, challenges, innovation, and opportunities. I'm really excited to be moderating today's session, and we are joined by an outstanding panel. Can we go to the next slide, please? I want us to see our panelists. Yes. So we have Emmanuel Karamage, who is the project coordinator at Rwanda Men's Resource Center in Rwanda. Oluwatoyin Ogunkomi, who is a family psychologist at Parenting Support System in Nigeria. Beatrice Ogutu, executive director at Investing in Children and Their Societies. This is based in Kenya. Godfrey Siu, facilitate lead at the Global Parenting Initiative and senior lecturer in the Department of Child Health and Development at Makerere University in Uganda. And we also have Shingurai Amos Pongona, who is the Deputy Director for Child Protection Services at Zimbabwe's Ministry of Public Service, Labor and Social Welfare. So here's how the session will go. I'll kick off with a few rounds of questions for each panelist, and after that, we'll open it up for a group conversation. Before we move into the structured rounds, I'm going to begin with a broad opening question for each of our panelists to set the scene. And I'd like to begin with Toyin. Can you please briefly describe the current parenting landscape in your country, including the key challenges? Would also love to hear about your specific role in supporting parenting in your country.
Hey, good afternoon, everyone. I hope you can see me and you can hear me. Good afternoon. If you can see me and hear me, please let me know. Okay, great. Thank you so much, Dr. Isang. Thank you, everyone, for being here. And my hope is at the end of this session, we'll be able to come up with a lot of ideas, collaborations, and solutions to what is happening in Africa. So the question says, I should talk about what is happening in the parenting space in Africa, in Nigeria to be specific. Yes, to Nigeria to be specific. So for me, in Nigeria, I would say it's a mix of strength and a bit of a struggle. What do I mean by that? In the Nigerian parenting landscape, we have parents who want to raise children, parents who are putting all the effort in raising their children, using part of our traditional methods, and also trying to use the new parenting styles that are being taught to them. Because based on where they're coming from, these parenting styles, which I would say is not new in other climes, but could be new to them because they are used to the harsh parenting method, the authoritarian parenting method. But in Nigeria, we now have parents who are tilting towards the authoritative and, would I say, gentle parenting style. So like I said when I started, I said the landscape of parenting in Nigeria is a mixture of strength and struggle. So when I talk about the strength is you see parents who are committed to raising children who are respectful, children who are resilient, children who are successful, and they are using the traditional values of respect for elders, being responsible, being honest, having good family values. However, the present challenges we're having now is that we have a lot of parents, let me not generalize. We have parents who are trying to navigate the different changes happening in terms of social changes, in terms of the urbanization, economic pressure of having to go to work compared to before where one parent was always at home. Now we have the two parents having to go to work, meaning that they have to leave their children at home in the care of other people, probably the house help, the drivers, or in school.
Sorry,
Another
Tony, I'm going to cut you in because I'm really worried about this. And I know that you have a lot to share. Hopefully, you're
Oh
going
my
to have the
goodness.
opportunity to speak to us more about that. But let me ask you, can you
Okay.
tell us a little bit more about your specific role in supporting parenting in the midst
Yeah.
of, the strengths and the
In all
weaknesses?
this.
Yes.
Thank you so
So
much.
briefly, we
So
want to hear about your role.
briefly, what I do, I have an organization called the Parenting Support System, whereby I serve as a bridge between the parents and the children. At the organization Parenting Support System, what we do, I provide trainings for parents. I do trainings, parenting trainings. I also do therapy and counseling for adolescents and young adults. Not just that, I also provide them with structures on how to navigate different challenges happening in their homes. For example, I have the Smart Parenting Coaching Academy. And I also have a website, a WhatsApp group whereby I talk to parents every day. I drop content, I drop advice, I give them tasks, we do challenges every other week. And this is where I serve as a bridge between helping
Amazing.
parents to moving from the parenting method that is not empowering towards a parenting method that is very empowering.
Thank
Thank you so
you.
much.
Thank you so much. I mean, if we had all day, I'm sure there's a lot of interesting things you have to share with us. But feel free
Honestly,
to put the links in the chat. And I'm
yes, I
going to
will do
go
that.
over to you, Emmanuel, and I'd like to hear about the current parenting landscape in your country, including the key challenges. We also want to hear about your specific role in supporting parenting in your country. Over to you, Emmanuel.
Thank you so much, Isange. We in Rwanda, the government of Rwanda is putting more effort in a parenting system by installing policies, regulation, even strategies to promote positive parenting. And it is investing much money because you have a specific national childhood development agent, which is coordinating all intervention related to area childhood development, including parenting. And then the government is revising gender policies, child protection policies. It is in charge of coordination mechanism. Even it is putting more money to leverage and to coordinate all the innovators. My organization called the Rwanda Men's Resource Center, we are working hand in hand with the government to promote a positive parenting through men's engagement by challenging social and gender norms that are hindering men to be part of the parenting system. In meanwhile, we are facing the persisting gender norms. We are facing the physical punishment because of social norms. The physical and the corporal punishment are still available, but the government is putting more effort to store different ECD centers by maybe ECD, community-based ECD and school-based ECD and home-based ECD, where the government is encouraging men and fathers to be part by also encouraging parents to be part of the journey. I think, in short, that's what I would say, and happy to respond to additional questions.
Amazing. It's really exciting to hear about the government support. And I think that's something that is really remarkable here is the work that you're doing engaging fathers in parenting. It's not so common, and we'll have questions We'd really like to hear more about that later. But before then, I want to pass over to Beatrice to tell us about parenting in Kenya. So Beatrice, could you please briefly describe the parenting landscape in Kenya, including the key challenges, and of course, share with us your specific role in supporting parenting in the country.
Thank you so much, Dr. Isang. Thank you, GPI, for having me. I'm really glad to be part of this important conversation. I lead the team at Investing in Children and Their Societies, and we are all about creating safe and nurturing spaces where children and their families can truly thrive. Thank you for your question. So what does parenting look like in Kenya today? Just as the previous speaker from Nigeria has talked about, it's a mix of efforts, love, struggle, and survival. Our data does highlight that many parents are raising children in environments that are shaped by violence, poverty, and inherited norms, often without the tools they need to raise their children differently than they were raised themselves. Our data also highlights the fact that violence within homes, especially violence against children, has reduced in the period between 2010 and 2019. But however, the rates of violence are still alarmingly high in the context. Nearly half of our children say they're experiencing violence, especially from those that are meant to protect them. So for us, this is not just a parenting issue because violence is personal to every child. For us, it's a national emergency, and therefore it calls for national action. And therefore, we've been spreading the message that it's everyone's responsibility because the consequences remain public. Clearly, we are seeing what is happening behind closed doors, shape every aspect of our society, from our schools to our health systems to our protection system, and overall in our economy. So if you look at our recent VAC survey, the 2019 one, it's clear that violence is being normalized, help is becoming rare, and silence becomes the default state for most of us. And our role as an organization is to be able to shift that. So particularly, I'm responsible for leading and amplifying the importance and benefits of our gender transformative parenting initiatives that are geared towards reshaping and supporting parenting and caregiving in Kenya. At ICS, we remain intentional in terms of implementing and scaling gender transformative parenting programs. One, to promote the well-being and development of children and their caregivers, and two, to address the various intersecting forms of violence at family level. We are really happy and glad as a country that based on this curriculum that we have implemented over the last 10 years, the Kenya government used it as a basis and foundation for adopting the National Positive Parenting Program that was launched in 2023 in Kenya. So we are happy that this program is influencing change, but of course, challenges still persist in terms of reaching scale, and especially the most marginalized parents and caregivers. But we are happy to share more because we are delivering this program to shift norms. We are striving to embed what works into policy and systems, and we are operationalizing change through community entry points and systems such as peer groups and government frontline workers. Thank you. Back to you.
Thank you so much. Thank you. But totally agree with you that violence calls for national action. And shortly, we would like to hear your thoughts about that and the political commitments in Kenya. But first, Godfrey, over to you. We want to hear about the current parenting landscape in Uganda, including the key challenges. And please share with us about your specific role in supporting parenting in your country.
Thank you very, very much. I'm so honored to be here. I'm glad to be part of the conversation. Apologies, even when the internet connection and Zoom had failed me, but I'm glad I'm here. It's really a pleasure to see that as a community we continue to communicate, to discuss and share in this space. So thank you for the opportunity. Parenting work in Uganda, as in many other countries, is happening in a context where poor parenting is characterized by violence, child maltreatment, child neglect, poor ECD indicators, and a context where strong negative norms, especially gender norms, shape parenting outcomes. And so these are the things. I'll not give you the statistics, but they are not too far away from what Beatrice has told you about the situation in Kenya. And in response to these poor outcomes, I think that there has been an increasing policy interest in Uganda, very much influenced by the global policy context, actually. And so there is momentum that is being generated quite seriously over the past few years to optimize parenting interventions. And drawing on from the international global frameworks such as the WHO, the INSPIRE, and so on, the Uganda government also has lots of policy frameworks that are relevant for influencing parenting work. So parenting work is happening in a policy context that is quite supportive. Nonetheless, it still means that it still needs to be strengthened. So in response, we witnessed a proliferation of parenting programs led by civil society organizations, faith-based institutions, development partners, as well as government sectors, actually. We conducted a mapping of parenting initiatives in the country some years back, about 4 years ago in 2021, 22, and found that there are actually over 100 parenting initiatives with various sizes and levels of effectiveness. Over 70 agencies said they do some parenting work. It could range from a simple seminar, one-day workshop, or actually a long program such as one which has 10, 15 sessions. So there's some effort going on, but these efforts are limited and they haven't yielded a lot of progress, or we are not where we want to be due to many obstacles. One of the main obstacles is that our efforts are still quite fragmented. Sometimes they are duplicative, and there has been a limited coordination framework. And also, I think limited prioritization of evidence parenting models, those that are backed by scientific studies or rigorous evaluation. Most importantly, we cannot fail to say this: underfunding and limited technical capacity and skills to actually run effective interventions. And we know that without these things, without a strong coordination mechanism, without strong advocacy, and without consensus on parenting, priorities may remain elusive. But over the last few years, Uganda government has made several strides through the dedicated effort of the Ministry of Gender, Labor and Social Development, with working with NGOs, researchers such as ourselves. We are building a robust evidence-based, and actually we are very excited about the national framework and systems that are being created for parenting support work. And recently, the government, last month, the government of Uganda launched 3 key documents. One of them was the National Standards for Parenting Programs. Second is the National Manual for Parenting Training, and the National Data Hub. So this is where we are. Thank you.
Thank you so much. I'm sure there will be opportunity for you to tell us more about the National Parenting Strategy. At this point, I'm going to invite Amos to tell us about the current parenting landscape in Zimbabwe, including the key challenges. Would also love to hear about your specific role in supporting parenting in your country. Over to you, Amos. Amos, if you're speaking, I'm afraid we are not able to hear you.
Hello?
Yes, I can hear you now.
Oh, it's okay. Okay. So I was saying that in Zimbabwe, maybe our journey on positive parenting, I can make reference maybe to a period in 2010 when the government of Zimbabwe, through the Ministry of Public Service, Labor and Social Welfare, we initiated family clubs model. So this model, it was being implemented under the National Case Management System for the welfare and protection of children as a key intervention in addressing violence against children. And later on, you would find that following this, the family clubs model that we were implementing, later on, you'd find that there are many other organizations that began to implement various parenting models. So to date, Zimbabwe, we managed to do a mapping exercise in 2023, 2024. And that mapping exercise, it actually helped us to identify the current parenting models that are being implemented across the country. And we have almost about 17 parenting models that are being implemented across government as well as NGOs, some of them that are donor supported. So you would find that most of these models, they are program specific, while list government, mainly the two main major ones that I can make reference to the models, the family class model, and then the parent to child communication, which is being implemented by Ministry of Health. This one, it has got more geographical coverage across the country, but then in terms of some of the weaknesses of some of these parenting models that we're implementing is that in as much as they might be across the country, but they are not covering all the wards across the country. And then what is the background that Zimbabwe is grappling with, where we are coming from? Maybe I will start with the positive issues to say that Zimbabwe is a country which has got a very, very rich tradition, which is based on the Ubuntu philosophy, where we place so much value in raising children within our family settings, and then also a strong understanding of the contextual issues that also influence parenting. So we build on this tradition of Ubuntu and the commitment that our people have towards parenting. And then in terms of the current landscape, Zimbabwe is grappling obviously with the aftermath of the COVID-19, as well as the effects of climate change. And then as a result of climate change, you would find that there is issue of migration, labor migration, where you now find that some of the children, they are being cared for within kinship care, and then others, they are being cared for by people who are not necessarily their biological parents. So at the moment, you'd find that we are currently grappling with a situation where about 60% of children without parental care, they are being cared for by grandparents. So as a result, there are intergenerational complexities that are associated with the age difference between the aged caregivers as well as younger children. So it presents a lot of issues in terms of parenting. So we are also grappling issues of our drug and substance abuse, where we need also to ensure that our parenting interventions, they are relevant to the current emerging child protection issues that are in our country. So as a country, we have made commitments during the Global Ministerial Conference.
Thank you, Amos.
Thank you.
Thank you. Thank you so much. But that has really been helpful in helping us have a better context of parenting in Zimbabwe. And thank you so much to all the panelists. I think it gives us a strong foundation to understand both the opportunities and the challenges across the different countries in Africa. And with that, I want us to move our focus to parenting practices, strategies, and political commitments. And this time I want to start with Emmanuel. Emmanuel, Rwanda has been doing some remarkable work engaging fathers in parenting, and you spoke on that, you touched on it when you were giving us your opening address. Could you share what you have found to be the most effective strategies to shift gender norms and encourage fathers to actively participate in child rearing and play? I think we may be having a little bit of technical challenge with his audio.
Isang, the first thing is to have its gender transform. Hello?
We can hear you. And if it's helpful, feel free to switch off your audio, your video.
Okay, thank you. I was saying that Rwanda started by we have a political will where we are striving to have equal rights and equal opportunities and promoting gender equality between men and women, girls and boys. So we have now the new gender policy where men and women share the same responsibilities at household level and then at national level. Coming back, how do we engage the fathers or men in this landscape? We started by advocating for policy change so that men are not a stranger to the ECD and the maternal and child health in general. So from the planning, we plan together, but also the entry point is the fatherhood. Maybe reference to the project that I'm coordinating, the fatherhood is the entry point. But whatever we are planning to do, we are hand in hand with the government from national level, sub-national level, and then community level. If it becomes to engage fathers, it is not a civil society organization alone, but together with government. And then men are not seen as challenges. We are transforming them into opportunities and allies to promote a positive parenting. This means we are using a gender transformative approach, as said by Beatrice, which by inviting men and women together, they are discussing the cultural aspects that can negatively affect the role of men in parenting system. So I would say, in brief, from the planning, we are planning together with the government. From the implementation, we are implementing together with the government. From monitoring and evaluation and even research, government is on the forefront. And then we agreed that men are not a problem, but let's transform them as a solution. That is the reason why, by engaging them through a fatherhood program, it become easy and even important to challenge all those social norms, as said my colleague from other part of the country. That is, in short, what I would say. Let's maybe focus on men alongside with the partners so that they are sharing the same responsibilities from pregnancy, delivery, and even parenting system. Thank you.
Thank you. Thank you so much, Emmanuel, for those valuable insights on engaging fathers. Godfrey, I'm now turning to Uganda. And you had mentioned the national parenting strategy that Uganda is advancing. Could you explain the key components that are needed for such a strategy to be effective and embraced at all levels?
Thank you, Isang, and thank you, Emma, for your insights as well. So Uganda's national strategy is anchored around three key frameworks: the National Parenting Guidelines, the National Manual on Parenting, National Standards on Parenting Programs. And the aim of the strategy is really to provide principles, provides ways of building national systems and capacities, and to promote consensus in this field of parenting. But also it's meant to support and promote implementation of evidence-based parenting interventions. And also we did a multi-sectoral effort involving government, civil society organization, communities, researchers, and development partners such as UNICEF. So key strategies to make such key components that make such a strategy work. One is first of all, I think we created a coordination and consensus building platform. We created the Uganda Parenting Agenda Consortium, which brings together stakeholders involved in parenting work. And this is a landmark initiative. It was the first of its kind, and it brought together people as sort of a unifying framework for rallying people together, aligning diverse stakeholder goals, and creating a shared vision on parenting. That was the main, and I think it really brought people together. Equality, whether you are a big organization or small, there was no discrimination. And this is coordinated by the Ministry of Gender. The second thing is identify who is doing what. In a setting where we are saying parenting is new in a new programming area, but at the same time, we are seeing a proliferation. There are so many people who have joined the sector. It's important to know who is doing what. And that's why we conducted a mapping of parenting interventions, again, through the recommendation of the National Consensus Platform, the Parenting Agenda. And
I think we have
also helped us to know in the country and point to where, even when the government,
Godfrey,
sorry,
I think we lost you a little bit there.
I think so as well. Apologies for that. I'm
No
thinking,
worries.
Okay, so just help me. Where did you lose me from so I can quickly say it?
Maybe what I should say is maybe you just have another 30 seconds to wrap up for us.
Okay.
But I'm really interested.
Okay.
Yeah, go on.
So identify who is doing what. That is map out where the partners are and who is doing what kind of program. And then also that will be useful because it helps to see the reach of programs and services across the country. And then I think we could say build systems for standardizing parenting work. We created standards for parenting interventions, and these are useful for checking the quality of interventions in the country and emphasize the role of evidence generation in those programs. And then finally, I think it's important to do a national parenting database. Again, this also for capturing data regarding distribution of parenting programs, and it helps actors also to track what they are doing. So these are some of the pillars that work.
Thank you so much for breaking that down so clearly. And if you have any publication on that, I'm sure the people in the audience, those who are listening, would be interested in seeing that. So feel free to share it in the chat. Okay, I'm moving over to Toyin, Nigeria now. Toyin, you did mention, that Nigeria has a mix of traditional and modern parenting practices. So in your experience, which parenting practices are particularly effective in promoting child well-being? And how do this parenting, the traditional and the modern, how do these coexist with cultural values?
Okay, thank you so much, Dr. Isang. So you asked which of the parenting styles is better to support a child's mental health. I'm paraphrasing. I would say the authoritative parenting style, whereby the parent and the child are in kind of collaboration. The parent sets expectations with the child, not for the child, with the child. And the parent also provides structures and support whereby the child can achieve those expectations. As a family psychologist, most of these cases I work with, or most of the people I work with, I see that gap in the parenting. Either the parents are too harsh or the parents are very permissive. And because of this, it actually affects the child's mental health. So mental health in terms of depression, anxiety, and also for some substance use. So that's that. Now, the second part of the question, you said that. Second part of the question, please.
Second part of the question is, how do these parenting practices coexist with cultural values?
Yes. So for the authoritative parenting style, like I said, it has to do with parents setting expectations for the children, parents supporting the children, and parents also being physically and emotionally present in the lives of the children. Now, how does this? So one of the things I do in the smart parenting community is that we try to bring in our basic traditional values like respect, resilience, honesty, all those values, all those traditional values. We try to introduce them with our modern parenting style, which is authoritative. And how do we do this? We set values for our children. We work with our children in learning these values, in putting these values as part of what they do. It becomes part of them. And when this happens, it's them integrating, bringing in the traditional values into their personal life. Like we all know, there are a lot of things happening on the global media space. And because of the things happening, families without proper values, families without these basic traditional, I call them traditional values, but they're meant to be values anyway. But families with without these traditional values, they would struggle because of the influx of different things happening online. One of the things I tell parents is that, see, your child might be in Nigeria, but your child is a global citizen. Your child has access to the TV, has access to internet, has access to things happening around the world. So if you do not bring these values, if you do not teach them these values early, things happening out there will actually influence them, and they might want to start doing things they see online. But when you are there in the home as a parent, you're able to teach them your values. You're able to, and as parents need to be digitally literate. You need to know what's happening online, in the online space, with artificial intelligence, what's happening. Because if you don't know all these things, your child will come and your child will present things that are strange to you, and you wouldn't know how to handle them. So these are part of the things I do in the Smart Parenting group, how we help parents to integrate their traditional values while using the modern techniques of parenting. Thank you so much.
Thank you. Thank you so much for highlighting that balance between tradition and modernity. I'm going to go over now to Beatrice, because I want to hear about gender transformative practices in Kenya. So these are increasingly being integrated into parenting programs in Kenya. How have these been implemented, and what impact have they had in the country?
Thank you so much for the question. I want to build on what our previous panelists have talked about. So based on our cultural norms, it's easy to talk about gender transformative parenting program, but there is a lot of misconception about what gender transformative parenting or having a gender transformative lens is all about. So we have embedded this within the National Positive Parenting Program, but basically breaking down it from a very abstract point to a very practical point of view. So on one hand, we used to think that parenting is mother's work and discipline is a father's duty. Then gender transformative parenting programs amplifies that both parents are caregivers and neither of them needs to cause pain, for example, to gain respect or to bear the burden of caregiving alone. So when we invite men into the caregiving space, they are not just helpers, but as nurturers, then we are able to transform an entire family. Secondly, when we raise children, both boys and girls, with equal love, equal care, and equal opportunity, then we are raising a just society. So breaking down these elements into very practical terms enabled us to raise awareness and increase understanding around what gender transformative parenting programs are around, including issues around decision-making, because then in too many homes, decisions are made by one voice, even though evidence continues to suggest that when everyone participates, the families thrive better. And therefore, gender transformative parenting programs are able to create these spaces for shared decision-making, shared power, and shared care. So these are some of the reflections that we have tried to embed in our curriculum over the last couple of years. And this curriculum now being able to embed these reflections, challenge the existing norms, and promote positive practices while building skills has been the foundation of the Kenya National Positive Parenting Program, which is now being scaled across different contexts, both development and including refugee settings. And this understanding has amplified the benefits and the added value of making parenting programs, which are, of course, many in the country, as Godfrey had already mentioned. There are different organizations implementing different pieces, but bringing them all together and implementing them from a gender transformative lens has been quite beneficial for promoting child development and addressing the different intersecting forms of violence within the family. So through the National Positive Parenting Program, we've seen this curriculum now being implemented through peer groups, through home visitation. We are becoming more deliberate and intentional to mobilize and include men in the discussions. And increasingly, we are seeing that the positive parenting program is being mainstreamed into other national programs, including the nutrition program, the cash programs that are within our social protection space, and more donors coming into the space to be able to invest in this particular work. So as a result, we are seeing families reporting greater safety, stronger bonds, reduced violence, and healthier parent-child dynamics. We are seeing at individual level, parents gaining confidence, emotional support, and renewed purpose. At system level, we are seeing a lot of policy changes. So we have the new Children's Act, we have the new Family Promotion and Protection Policy, we have our national violence prevention plans. All of these are avenues that now as a country we are using to ensure that the program is embedded and that it can be able to reach as many parents as possible, while continuously communicating and amplifying the benefits of a gender transformative lens in programming for parents. Back to you.
That's so exciting to hear. Thank you so much for sharing. Okay, Amos, over to you. Zimbabwe has made a strong political commitment to universal parenting support. How is this commitment translating into concrete actions on the ground?
It's okay. Thank you so much for the question. So Zimbabwe has demonstrated political commitment in terms of universal parenting support, scaling up universal parenting programs across the country. And this is evidenced by the commitment that I hinted on, the commitment that we made where our Minister of Public Service, Labor and Social Welfare made a commitment to ensure that we implement some of the strategies that are in the Inspire strategy. And during at the Bogota conference, there are 3 breakthrough strategies that were agreed upon by all participants, and one of them being universal access to parent and caregiver support, which we are now scaling up through the development of a national parenting manual, which is contextually relevant as well as which broadly addresses some of the emerging concerns which require a stronger parenting program. And then again, this commitment is also shown by our legislative reforms. So in 2023, the Children's Act, it was amended, and now we have a specific section 49, which is speaking to issues of early intervention and family preservation. So under this provision, we have a mandate as a ministry to develop a national parenting program. So this national parenting program is touching on issues of prevention as well as response. So under this, you would find that parents who are convicted of ill treatment and neglect of children, a judicial officer, he can recommend that they be mandatorily enrolled under a positive parenting program, which is administered by either government or even by NGOs. So there is no other indication of political commitment other than this maybe that I can state, but also it's also typified also by the development. In fact, sometime this year, in March, Cabinet approved the early childhood coordination framework. So this framework, it was spearheaded by the Office of the President and Cabinet, seeing the importance of early childhood development, guided by the nurturing care framework. And this integrates components of health, components of nutrition, components of early learning, as well as issues to do with welfare and parenting. So all these components, now we have got a coordinated framework that is also bringing in all the critical key line ministries that are responsible for early childhood development. So ECD cannot be separated from issues of parenting, because the nurturing care framework, basically, it also provides the standards that guide the necessary nurturing and responsive care that children are supposed to receive at an early age, for us to avoid some of the challenges that we might grapple with in later years. And then again, we have got the National Action Plan for Children, which was also developed by the government. It's now the fourth phase. And under this National Action Plan for Children, we also have got issues of parenting strongly addressed through family strengthening interventions being implemented by the government of Zimbabwe. Thank you.
Thank you. Thank you so much, Amos, for those reflections from Zimbabwe. And thank you to everyone who's spoken. It's really inspiring to hear the variety of strategies and commitments across the different countries in the region. And one thing that is clear to me, and I think to everyone who's listening, is that parenting support is gaining momentum, real momentum across Africa. And building on that, I want us to briefly see if we can speak on challenges and lessons for implementation and government partnership as well. So this time I'm going to start with Godfrey. Godfrey, how is Uganda's national parenting strategy addressing the various challenges that parents and families face? And I'm going to appeal to the panelists to please limit your responses to no more than 2 minutes. We'd like to take another round and then have enough time to take 1 or 2 questions from the audience. Godfrey, over to you.
Okay, so at the risk of restating some of the things that have been stated already, the Uganda National Parenting Strategy is a work in progress. It's work that it gained momentum a couple of years ago, and we're still learning a lot from it. And so there is not, we cannot say we are where we want to be, but how is it addressing the challenges? One of the main challenges we had in the country was lack of evidence-based interventions, or let's more accurately, existence of few evidence-based interventions. As those among those few, we actually had several of them being imported into the country. That's not bad, but sometimes we didn't have capacity to adapt, do cultural adaptation, and so on. So we, with our national parenting strategy now, we are emphasizing a couple of things. One is homegrown interventions, which are evidence-based. In the absence of that, we encourage cultural adaptation following a systematic approach, moving away from, the usual procedure that people just do, pick a document and say, okay, I think let's start working. So cultural adaptation following systematic approach. We making sure that there is now consensus about what parenting should look like in the country and bringing together different stakeholders. So we no longer have everyone do their own thing as they wish. And the standardization of parenting programs is something that is picking up quite a lot by ensuring that the government has a document that it uses, check the quality, and supervise parenting interventions. This has been launched last month. We are also now doing capacity building. We are conducting training of frontline workers, the practitioners, as well as policy implementers on evidence-based interventions. And the emphasis now is generate evidence as much as possible so that we don't waste our resources.
Amazing. Thank you so much for sharing. And Toyin, this is for you. Corporal punishment remains common in many communities in Nigeria. How do you navigate conversations around it while promoting positive parenting practices?
Okay, thank you so much. So corporal punishments from the colonial times, it's something that it's been embedded in our parenting and family system. And with the work I do, part of the things I do is I start with the parents by introducing them to discipline, which is not punishment. And I will start by being respectful about it because corporal punishment, like you said, it's been there since time immemorial. But how do I now navigate? So I'm talking as myself based on the work I do with parents, is I bring evidence-based, I bring facts and figures showing them the reasons corporal punishment isn't good and why they should introduce discipline rather than punishment, shifting from discipline to punishment, shifting from punishment to discipline, shifting from punishing your children to teaching your children what you want them to do, and also moving from punishment to connection. Instead of controlling, you're connecting with your children. That is how they'll be able to provide positive discipline, and they'll be able to teach their children what they want, instead of them using the olden way or olden methods of correcting, which is known as corporal punishment. So part of the things I do, I teach positive discipline. I help parents to understand the difference between punishment and discipline. I also speak with them about open communication, setting clear boundaries, being consistent when it comes to consequences, and being consistent with them carrying out the expectations and what they want from their children. Not just that, I speak with the parents and I let them understand that they need to build a relationship first with the child. That when you build a relationship first with the child, when you connect with the child, it will be easier for you to correct the child. So these are the things I do based on my organization. This is what I do. And we use evidence-based strategies in implementing this. Thank you so much.
Thank you. Thank you. I think that gives us a lot to think about. Amos, this is for you. In Zimbabwe, many families face multiple stressors, such as migration and grandparent-headed households. What approaches are proving most effective in supporting these families?
Okay, thank you so much for the question. So like I indicated in my previous submission to say that we have issue of labor migration, which also results in grandparent-headed households, as well as issues of substance abuse. And then in terms of the approaches that are proving to be effective in supporting these families from these multiple stressors is the need to design and implement family strengthening and family preservation models. Like for instance, when you are focusing on kinship care, there is need for us to ensure that we have got models that are homegrown, as well as evidence-based models that address maybe the contextual issues that affect these grandparents who are providing care for these children. You would find that a majority of these children, they are being cared for by grandparents. Some of them, they might not be able to understand some of the concepts, especially when they are models that are developed in the Western countries. So as a result, we need to ensure that even if they are models that are developed elsewhere, they are adapted to suit our own cultural and contextual needs. And then this is one challenge maybe that I've been seeing, that some of the models, the method of delivery is exclusively in English, and then maybe there's need for us to have translated versions to suit the local languages. And then again, even the approaches, they need to identify with some of the approaches, the parenting approaches, even the methods of discipline, they need to be quite relevant. Because, for instance, telling a grandmother who is down in the remote areas that you need to use a naughty corner when a child is naughty, when she's living in a round house where there's no that corner, when you don't have that corner that we might want to refer to. So we need to find a way of couching our models to be culturally relevant, and then that they be able to understand them better from their own perspective. I know that we are not saying that as Africa, we do not have positive parenting as a key aspect of our culture. But what we need is to identify those positive parenting practices and build on them and strengthen them and encourage even our communities to adopt them and scale them up, yes, depending on the context where they are in. Yes, thank you so much.
That's really helpful. Thank you so much. Very informative. Okay, this next question is for Emmanuel. Emmanuel, you've worked closely with the Ministries of Health and Gender. What lessons can other countries learn from Rwanda's approach to government partnership for scaling up parenting programs?
Thank you. When you are working with the government, you become more strong. I would say when you are working with the government, even there is no doubt that you are contributing to the national effort, and the government recognizes your contribution as one of the contribution to the government outcome in terms of parenting and the other ECD programs. And one of the lessons is to plan together. From the planning, implementation, monitoring, evaluation, we need to be together with the government. So as per now, we are looking to scale countrywide the parenting program. If government is not aware of what you are doing, and if it is not aligned with the government policy and implementation plan, you can't scale the model because it will be of the short time. One of the lessons learned is to work together, to plan together, to implement together. Even if you have findings, as per now we had the randomized control trial for evaluation, and we did another round of 6 years follow-up to assess the long-run impact of the positive outcome in the ECD program. So the government must be here to support you, and once you work together, you have a long-lasting effect of your intervention. Thank you.
Thank you, Emmanuel, for these insights. And Beatrice, we'll turn to you to finish this round with Kenya. And the question is, when designing programs with scale in mind, what factors should be prioritized to maintain quality and effectiveness as reach expands, particularly with digital delivery?
Thank you so much, Isang, for the question. The VAC study that we have in the country really does first emphasize the urgency of behavior change, not just scale. But when we are talking about scaling, what we prioritize is what Godfrey had talked about earlier, deep cultural adaptation, looking at the different contexts, ethnic communities, regions in the country, and trying to work with the different relevant reference groups to be able to adapt the national curriculum to fit the needs and aspirations of parents and caregivers of all walks of life becomes quite important for us to be able to ensure that it does speak to what we are aiming for in the first place. The second opportunity that we have is to strengthen grassroots systems for delivery. And that starts with a very clear professional development plan for master trainers, for community facilitators, and for the supervisors of the national program, so that then we ensure standardization and fidelity to the core aspects of that particular curriculum, even after the adaptation has taken place. And I know many a times when we're talking about innovation and scale, the digital platform becomes one of the complementary platforms to reinforce what in-person sessions are already talking about. But when talking about digital, using digital platforms to scale, one of the key things that we often need to be cognizant about is the need of not losing the human touch in the process, and which platform would then be most accessible in the different parts of the country. So our rule as a country and in general in our own programming is that if the platform or the curriculum does not build connection and speak to the aspiration of parents, then it doesn't, it doesn't scale quality in that sense. And therefore we are looking at, yes, blended approaches to go to scale, but these blended approaches should be cognizant of the cultural needs and experiences and context of the different places where this parenting program is being implemented, but more particularly the platform. So WhatsApp has been commonly used within the National Positive Parenting Program among facilitators and trainers of trainers. For the parents themselves, they also find it a little bit accessible. There are apps that have been tried by different organizations from time to time. And the evidence that we are gathering also from across Tanzania is that this can work, but they must speak to the literacy levels, accessibility of parents and caregivers, and be complemented with other services in ECD, in health, in child protection, even as we continue with the in-person sessions. So it's still a body of knowledge that we are building across the country in terms of how impactful digital platforms can be. but as standalone, but also when complemented or blended together with other platforms for delivery of parenting programs. But yes, they are a platform to leverage on and continuously learn on, even as the government also tries to explore how training can also be delivered for facilitators through the digital platforms. So yes, so those are some of the experiences that we can share, but there's a lot that we are also learning from our Tanzanian parenting app program that we are doing together with PLH. And those lessons are currently informing the innovations around the digital delivery that we want to explore as a country. Thanks, and back to you.
Awesome. Thank you, Beatrice. Wonderful insights from all of you. I think one thing that is clear is that challenges may vary, but there are lessons that can be shared across the different countries. And now I want us to look at sustainability, scale up, and addressing harmful norms. And this time I'm going to start with Emmanuel. Emmanuel, as we look at the delicate balance between respecting cultural practices and preventing harm, how can programs addressing violence prevention, both violence against women and violence against children, effectively navigate this challenge?
Thank you, Dr. Isang. Well, by using the gender transformative approach, we are trying to dismantle the gender norms by challenging them. By challenging those gender norms, we are sure it is definitely long-run sustainability. There is a long-run sustainability once they are challenged using a gender transformative approach. We did the RCT for evaluation. We did another one for evaluation of long-run sustainability. We find that once the gender norms and the other negative behavior are challenged, there is a chance to be let's say there is a long-run sustainability of the new positive behavior that are available among the participants. Then by challenging by engaging men, we are even preventing the transgenerational violence, where the violence from parent can be transmitted to the children, so that we are creating enabling environment at home where children can grow up. So we are challenging those social and gender norms, and we are creating at the same time the enabling environment of children, but also we are breaking the cycle of violence between parent and children. Once the social norms and the other malpractices are challenged, we are sure it can have a long-run sustainability once we are using transformative approach. I think that's what we do in Rwanda.
Thank you. Thank you so much for sharing. And I'm moving over to Godfrey in Uganda. Godfrey, drawing on the WHO handbook, what do you see as the most critical first steps that countries should take when planning for scale-up of parenting interventions?
Thank you, Isang. First, to give a bit of context here, in 2024, the World Health Organization authored a handbook for decision makers and implementers to support them to learn how to design, implement, and evaluate and scale up parenting interventions. This resource is freely available, I think, on the WHO website, and it is a must read. It is a must have, I think, for everyone involved in designing and scaling parenting interventions. And the handbook provides comprehensive advice for policymakers, practitioners, stakeholders, generally everyone who is in the business that we are doing now. So it offers practical steps, and the beauty of this is that it uses examples drawn from low and middle income countries. So you find relevant examples from Kenya, Tanzania, Rwanda, Uganda, South Africa, I think Zimbabwe. So this is a very, very useful handbook. I was very fortunate to be among the people who contributed to it, so I'm proud of it. Two or three critical steps. One is with regard to developing or choosing the right intervention. When choosing an intervention, I think it is important to think of an intervention that addresses the needs of the people. And we all know what to do. Begin with problem analysis, do literature review, identify existing efforts. What are other people doing? Many times we make a mistake and assume we are the first, and then we end up saying there is nothing being done, which is very unfortunate. Even what government is doing already is something worth noting. And then look at the existing needs of the people, do feasibility studies, and generate some information that can help you to build a theory of change around intervention. Related to developing a new intervention is adaptation. So adaptation is quite important. Thank you very much, Beatrice, for speaking about it. I won't say much more about the importance of adaptation, but also co-development with stakeholders, including parents and children. Because these are the things that promote ownership, and also they help us to check whether the program has initial evidence of effectiveness. Attention must be paid to the usually marginalized groups, ensuring inclusivity, and also tailoring approaches to families with children who have specific challenges. All of this will culminate in sort of matching the intervention objectives and the needs of the population and aligning with the country framework. And of course, this involves also carefully choosing an adaptation framework. Do you go for a light touch, for example, if you are scaling up an intervention and it's evidence-based but imported or it's not homegrown? What kind of adaptation are you going to do? Is it simple language translation that is called simple light touch, or are you going to undergo intensive, rigorous round of evaluation of an already effective intervention? It's also important to think about a scaling roadmap, which is something a little bit more, requires a detailed discussion here, but we have many existing roadmaps or intervention scaling up frameworks. Inspire has one. The ExpandNet, Spring Impact also has been doing capacity building for local partners. And these are all important toolkits that someone needs to know as a first step, and then allowing for flexibility of the intervention. Beatrice talked about strengthening systems for implementation. I think this is so critical. Determining what inputs are needed and what systems are needed, so that as you scale up, before you even begin scaling up, you have mapped out the systems that are required for that scaling to happen. And this includes human resources, of course, selecting who is the best implementer and why, mapping out who are your key stakeholders. And for those if you're importing an intervention, you're likely to be working, say, with the original developers. The original developers must understand that there will be a time when they need to let go of that intervention. For instance, if we talk about PLH, they have been very, very good at understanding that there is local capacity happening in the country. And so they should be able to let go and only do the higher level planning and guidance as a technical resource. Learning and sustaining research, embedding research in intervention scale up, because even as you scale up, it is not a sure deal that what has been found effective in some setting will retain effectiveness at scale. So we need to build a robust evaluation approach still, so that we can provide evidence of effectiveness at scale. These are the few that I could highlight, but I said this is probably much deeper, requires much deeper discussion.
Totally agree with you, but it's been so helpful to have you share those insights. And I really I agree with you that everyone needs to read the handbook. I shared the link here for the host and panelists, and I'll be so grateful if our host could share the link for everyone to see. And I really want to encourage everyone, if you haven't seen the handbook, the WHO handbook, please download it and go through it. It's really, really rich. Okay, I'm going to move over to Beatrice in Kenya this time. Beatrice, I think we all agree that funding cuts and systemic barriers are a reality for many programs. How do you address these challenges to sustain parenting programs at scale?
Thank you so much, Isang, for the question. There are several things that as a country we continue to do. One is to strengthen systems of support that are closer to the people. So really training, facilitating, and motivating community groups, community resource persons, frontline workers from government to be able to provide the day-to-day in-person support through peer groups, through home visitations, and through other platforms, including the digital platforms, become quite important for us. So identifying, mapping those services and being able to build their capacity so that they are available day in, day out to provide services to the people. The second strategy that we use as a country and even as the nonprofit sector in this space is lobbying for the institutionalization of funding across the two levels of government here in Kenya, both the national level and the county levels, where there are opportunity to be able to resource the parenting programs that are connected to the outcomes that we are currently aiming for as a country. One of the key things that has enabled us to move forward is the 5-year roadmap that was developed about 2 years ago. And with that, last year in December, the country launched the National Family Promotion and Protection Policy, which then paves way for ring fencing of resources within government itself to be able to finance the National Positive Parenting Program, which has also now been included in Medium-Term Plan 4 of government. So ensuring that these programs are institutionalized, the backing around the policies that are required is already there to pave way for resources becomes quite critical for us as well as a country. The other opportunity that we have is to embed parenting with existing national programs. We have the niche program, which looks at nutritional counseling plus cash transfers. We are looking at early childhood care and development programs in the country. We are looking at gender equality and promotion programs. So finding the hooks within each of these national programs that have already been resourced are quite critical avenues for us to ensure that we navigate the scenario that we are finding ourselves in with regards to the funding cuts. And of course, looking at how from a multi-sectoral perspective, early childhood care development work, the health sector, the child protection sector, the social protection, gender sectors can come together, because then each of them has a space to be able to implement aspects of the National Positive Parenting Program. Critical to this gap as well is the development of a national-wide data system that continuously helps us to gather both qualitative and quantitative data. With data drawn from government, then we are in a better position to drive investments that are data informed. So data system is still a big challenge, but it's also an opportunity that the government, together with non-governmental partners and partners such as UNICEF, Prevention Collaborative, Conrad Hilton Foundation, Eric's development partner, Freedom Fund, we are working together to try and see how we can resource the 5-year roadmap so that then we can scale across sectors and contexts, but also continuously gather data that informs us on progress and that drives investments across the two levels of government that we have, even as we continue to inspire communities through the systems of support to constantly also use their own resources, which they actually have. So harnessing local resources from local groups, from individual and local philanthropies, is also another strategy that currently as a country we want to leverage on in the wake of the new funding freeze and cuts that we are experiencing as a country. But spreading this work across different departments has also shown as to work, because then everyone has embraced and seen the need for their own department, whether ECD, child protection, health, nutrition. Each one of them has a space to be able to implement the core elements of the parenting program that we have as a country. And I think the last one is refraining a lot from the need for more pilots, because then we have a national positive parenting program that has provided us a good flight path to go on to. So then focusing all our attention as not-for-profits on this national program, which has a gender transformative lens and looks at several outcomes, instead of each of us trying to do our different pieces everywhere. So the country mobilizing and coordinating all actors to focus on one particular solution that can be adapted across is also one work. And lastly, we are looking at expanding the visibility of this work within the private sector, because then they have a role to play, including the faith sectors, because then they are now more and more embracing and using their various platforms to advance this work in their spaces and places of work. Thanks. Back
Thank
to you.
you.
Sorry
Thank you
for
so
the
much.
rush. There's so much.
I know, no worries at all.
Webinar on its own. Yeah.
And no, yeah, apparently, I wish we had more time. We would have loved to hear more, but these are really, really great insights. I'm sure that everyone on the call, we're all learning so much. And still speaking about global funding cuts, I know that it's not only Kenya that has been affected. So I want to turn over to Amos in Zimbabwe. And my question is, how is Zimbabwe working toward a homegrown parenting support model with global funding cuts? What elements are essential for it to succeed sustainably? Do we still have Amos on the call? Oh, it looks like we've lost him. Oh no, he's there.
Yeah, hello, I'm on the call. Yes, so you can repeat the question again.
Sure. So this is a question. With global funding cuts, how is Zimbabwe working toward a homegrown parenting support model? And what elements are essential for it to succeed sustainably?
Okay, thank you so much for the question. So in light of the global shifts in funding support, like I indicated that some of the parenting models that we are implementing in Zimbabwe, we have a number of them that were supported by partners, some through USAID, and as a result of the global changes that happened, which affected funding, you would find that there are some innovations that we made as a country in some of the areas where we were implementing, for instance, Synovio parenting model, particularly in Murewa, where we then, in fact, the way we were implementing Synovio, it was mainly being implemented through professionals who were trained as facilitators. But what we did then was then to work with our community service workforce, our community child care workers who are at community level, and these are basically volunteers whom we trained and capacitated and as facilitators. So they are the ones who have been facilitating these parenting models at community level, which is a more sustainable way of implementing parenting models, because they are already a part and parcel of the community, and then they do not require extra funding for them to be implementing these sessions. And we are now reaping better results as a result of this approach, which is basically riding on and integrating and leveraging on the existing child protection structures. So I think it is important to embed our interventions in the existing child protection structures, and this would actually enable us to have systems that continue to exist even beyond funding limitations. So it is also important that we also ensure that government increases public funding towards child protection, particularly on parenting. And then I'm glad to say that in Zimbabwe, due to the issue that we are grappling with of drug and substance abuse, even the high-level political players, they are recognizing the importance of parenting, and we are mandated as a ministry to be reporting on the parenting sessions that are conducted across the country on a weekly basis. So, and these cases, they are presented and the statistics are presented before cabinet. So with this commitment now, we have been seeing that there's now an increase in funding towards the parenting programs that are being implemented by government, with support from government directly, as Treasury is now increasing funding towards this. So I think it is important for us to ensure that public financing of child protection is also increased and scaled up to support these parenting interventions. So maybe for now, this is what I can say. Thank you.
Thank you, thank you, thank you. Great perspective. And I don't think we'll have enough time to take questions, but can I encourage, if you have questions, put them there. And I want to also encourage the panelists, please look through if there are questions and draft responses, because I'm looking at the time and it doesn't look like we'll have enough time to take questions. So I'm just going to direct the last question I have here for Tony, and please, may I appeal to take a minute or two to answer this. What are the most pressing challenges for parents in Nigeria, including cultural practices around discipline?
Hi, thank you so much, Dr. Isang. So right now in Nigeria, I would say the most challenging aspect when it comes to parenting. I want to go back to the other panelists who've said so much about their country having a national parenting framework or national parenting program, which I notice we don't have here in Nigeria. So we have a lot of people having parenting programs by themselves. Just a few are evidence-based. Like what I do is based on the training I got for the better parenting, parenting for Nigeria. That's the training I got, and that's what I use. So the major challenge parents have when it comes to parenting is they have very few evidence-based resources here in Nigeria on how to become better parents. I would start by that. Then also the global media, the challenge of the global media, we have a lot of influx of new ideas, new values coming into the country. And that is a major challenge for parents, especially parents who do not understand the digital space. They are seeing a lot of things coming in and they're like, what can we do? How can I get my children not to be so, not to spend so much time on social media? And that's where we come in and provide them with digital literacy, how parents can learn more about the digital space so that they can enforce and put the proper restriction for the children. The another challenge parents are having, apart from the influx of the global media, apart from not having enough evidence-based resources, is the fact of the cultural influence too. You have parents who, yes, they want to raise well-balanced children, but the fact that they still have this, some of their beliefs, cultural beliefs, is also affecting, is also a challenge for them. How do they navigate? How do they move from the cultural belief that they have into more edifying or more appropriate parenting styles or more appropriate parenting strategies? Then apart from that, we also have then the challenge of discipline. How do they discipline their children right? Then not just that, we also have the challenge of substance use, drug abuse. That's a major challenge we're having in Nigeria now. Thank you so much.
Thank you. Thank you so much, Tony. And thank you to all the panelists. It's been incredibly insightful to hear your experiences. Clearly, sustainability, scale, and cultural sensitivity are central to the success of parenting programs across the region. There's a question I would have liked to ask all the panelists, but there's no time. But if you can put in your response, quickly type it, I would appreciate it. And the question is, what do you see as a practical way forward to address the challenges facing parenting?
Can't hear you.
What concrete actions or strategies could make a real difference on the ground? If anybody can, and in the 2 or 3 minutes we have left, please feel free to type a response. Beyond just discussing What are the concrete actions or strategies that could make a real difference on the ground? It would be great to have your responses to this. There's a hand that has been up for a while. Jen, can we take this, or can we take this hand?
Isang, to be honest, I can't see the hand on my side.
There's a hand here, Camille Evans. Camille, do you want to unmute yourself and quickly, is that a question? Quickly ask your question.
I'm so sorry. I think that was in error. So I'll just look.
No worries.
I'm so sorry.
No worries at all. Thank you. So with that, I just want to say thank you so much to all the panelists for sharing your rich perspectives and sharing your insights. I'm sure that everyone has been inspired. I'm going to quickly hand back to Jen, and thank you so much to everyone who participated and who listened. Thank you, everybody. Back to you, Jen.
Yes, I think just to say thank you so much to Isang as well for moderating that session. I think your questions really brought out a lot of things people have been thinking about, especially participants, people that have joined. And I think a lot of connections were made if I look at some of the chat messages as well as the Q&A. So thank you to our panelists again for joining today. It was a very insightful discussion. And as Isang said, we obviously wish we had more time, but I do think people will be reaching out to you as well directly. And thank you for answering the questions in the Q&A box. I think that helped a lot. So we were able to get through some of the key questions people were interested in. And to the participants, to the attendees as well, a lot of people stuck around for a full hour and a half. We know it's quite a long session, but it was a special webinar highlighting, parenting in Africa. So really worthwhile. Thank you for that. And take care, everyone, and look out for our next webinar as well.